Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with a March 18th, 2021 update from the Dubuque County Public Health Incident Management Team. Dubuque County's COVID-19 new case trend line is trending downward, and the age groups within the 19 to 24 and 30 to 34-year-old age groups are accounting for 25% of the cases reported since March 1st. However, all other age groups are getting infected. Yesterday, Iowa added 38 B117 variant cases to make Iowa's total 63 B117 variants through sampling at the State Hygienic Lab. One of these variant cases is from Dubuque County. And nationally, 4,686 B117 cases have been reported. That's an increase of over 4,000 since March 8th, just 10 days ago. So regardless of which county have documented variant cases, we know this variant is circulating throughout Iowa. We follow variants to understand potential impacts on outcomes, treatments, and vaccine. So the best thing you can do is continue to follow public health guidance we've been doing for over a year now and get vaccinated as soon as a vaccine is available to you. Dubuque County continues to successfully administer all of the vaccines we are allocated, either from the Iowa Department of Public Health or the Federal Retail Pharmacy Program. As of today, 14,753 people have completed their vaccination series, which is just about 19% of those 16 years and older in Dubuque County who are eligible to receive a vaccine. In total, over 40,000 doses of vaccine have been administered to Dubuque County residents, and an estimated 82% of those aged 65 and older in Dubuque County are vaccinated, which is the group most affected by severe illness and number of deaths. So that's great news that this population is being protected through vaccination. We've also started vaccinated people 16 to 64 years of age with underlying conditions, putting them at greater risk with a COVID-19 infection. This is a big percentage of our population. And even though the governor announced yesterday that starting April 5th, vaccines would be available to anyone 16 years and older, those with underlying conditions, together with the over 5,000 manufacturing and essential workers identified in Phase 1B, will still receive priority for vaccinations here in Dubuque County. We anticipate receiving more vaccines after April 5th, but the incident management team does not know what that increase will be, nor the timing of when the additional vaccines will arrive here. So please be patient as we work through the priority groups and administer the vaccines as fast as we can. Know that more is on the way, and everyone will be given an opportunity to be vaccinated. For those of you who do not have access to internet or electronic scheduling, or perhaps you have a friend or family member that doesn't have that access, the state has set up the 211 phone line to assist. So just call 211 and they'll help you set up an appointment. For those without a healthcare provider, you can leave your name and contact information on the Dubuque County Sleeves Up phone line at 563-587-4950. And when vaccines are available, you'll be notified for an appointment. On to the newest season, spring break, and that time of year when many of us think about taking a vacation. Whether we're thinking of traveling by trains, planes, or automobiles, travel right now, more than ever, requires thoughtful planning, and by the way, is still not really recommended. Here's some things to look into before you even set your travel dates. What are the COVID restrictions in the country, state, or city you're going to? Are there testing requirements upon entry or when returning home? What is the current rate of infections in your destination? Are there ways to modify travel plans to add extra layers of safety? For instance, avoiding or spending minimal time in airports, bus, or transit stations. Where will you eat or stay upon your arrival? Are there restaurant or hotel restrictions, or are COVID mitigation measures in place? What kind of test is required before you leave or when you return home, and where can you get tested? And what's the minimal interval between testing and arrival? These are all important things to consider, And a lot of this information can be found on the CDC or airline websites, but you also have to check state and local jurisdiction websites for specifics. Then, when you return home, quarantine is still recommended, whether it be for the full 10 days or even more desirable is to get tested 5 days after your return. And if you're symptom-free by day 7, that is sufficient quarantine, especially if you continue to monitor for symptoms for the full 14 days. This is all regardless of whether you've been vaccinated. As we gather more data and learn more about vaccine effectiveness over time, some of this may change, but for now, these requirements, including quarantine, are essential. Even if you've been fully vaccinated, you should still take steps to protect yourself and others in many situations, because not everyone has been vaccinated yet, so you have to continue to wear a mask, staying at least 6 feet apart from others, and avoiding crowds and poorly ventilated spaces. Take these precautions whenever you are in public, gathering with unvaccinated people from more than one other household, visiting an unvaccinated person who is at increased risk of severe illness or death from COVID-19, or who lives with a person at increased risk. And you should still avoid medium or large-sized gatherings and delay travel until absolutely necessary. An early spring weekend is almost upon us, and that means tip-off of the NC2A men's and women's basketball tournaments. This is long awaited and usually a fun time for get-togethers and going to bars and restaurants to watch the games. Even though our bars and restaurants are open, masks are still required when you're not seated for eating and drinking. Something to keep in mind, as my friend Dr. Michael Osterholm of the University of Minnesota stated yesterday, when bars are crowded, the noise level goes up, and then people talk more loudly, and talking loudly projects the virus further into the air if you're infected, he said. I would add cheering to that. So think about that when you're in an enclosed and crowded indoor space. You can feel free to gather with fully vaccinated friends and family in your home, but continue to limit gathering with others outside your household. We're still above the number of COVID infections that were happening last year at this time. We've come so far, but we have a long ways to go before returning to all the normal social activities we enjoy. So in the meantime, fill out your bracket, text, FaceTime, phone, or Zoom during the basketball games and in between, and get outside and enjoy the early spring weather. It will do wonders for your general outlook. Thanks for tuning in today. Continue to stay safe. You know the drill, and remember, we're all in this together.